Welcome back to Better Kansas City. So those painful and damaged joints you're dealing with are not getting any better, and most likely they're going to keep on getting worse. So why wait to get the relief? Dr. Robert Greiner from St. Mary's Medical Center is here to share the latest in orthopedic technology. So a lot of people may have these aches and pains we've been talking about. So what improvements has robotic knee surgery actually made over a traditional knee surgery?
With traditional knee surgery, they use jigs, screws, implants that go into the bone, violating some of the canals of the leg bones. With robotic surgery, we're able to offer a much more advanced, customized approach to get an implant that's going to last a long time and hopefully not need a secondary surgery.
Okay, when you say robotic knee surgery, to me, I think that this could be something of the future. You know, how would we know if robotic surgery was right for us?
If you're a candidate for traditional knee replacement surgery, robotic surgery can also be an alternative. It's a great way to get a precise, individualized result that will last for many years and hopefully give you the pain reduction that you're looking for.
Okay, pain reduction, that is huge to so many people. I know that a traditional knee surgery, there is going to be some time that it takes to come back from that. Does robotic surgery actually minimize that time?
Robotic surgery does. It makes the incisions much less invasive, the muscles don't have to be violated as much, and you're able to get a quick recovery. There's still some physical therapy that needs to be done afterwards, but gives you a quicker result and a much more individualized result.
Okay, and we're looking at a lot of pictures, or we actually just saw a lot of pictures. Is that some of the material that you work with when you're deciding if it's right for someone?
It is. We utilize a specialized robotic handpiece. We're able to use tried and true materials that go into the knee and provide a long-lasting result that will continue to give them relief of their pain.
Okay, and of course, the ultimate thing is to keep yourself healthy or as healthy as long as possible. So if people are experiencing some of that pain, what are things that they can do to extend the life of their joints?
Sure, they do anti-inflammatory pills, different kinds of herbals, maintain a healthy, active lifestyle, and continue to watch your weight and weight management.
Okay, so those herbals and maybe weight management, let's touch on that a little bit. What are some things that you recommend?
So you can do non-invasive medications, non-steroidals, which would be ibuprofen or Aleve, glucosamine chondroitin, which is an herbal vitamin, as well as turmeric and things like that that you can put in the mac and cheese. So.
Oh, we can put it in the mac and cheese. Okay, I know Bill loves that. Now, let's also say this, right? So anything else that you recommend to keep the joints healthy? I know you mentioned having an active lifestyle, so can actually working out help us in that process?
Certainly. Staying active with a low-impact aerobics, elliptical machines, biking, things like that as we age will continue to give your joints health and your body longevity.
Okay, and you've obviously been performing joint surgeries for a very long time. What is it about the robotic surgery that you really love?
I think I find that robotic surgery gives you a more advanced approach to the patient, gives you a customized and technologically advanced way to get their knee replacement done.
Okay, and would you say that when people are coming in for the first time, is this something that they're aware of, or oftentimes do you have to start at the beginning and walk them through the whole process?
Sometimes people have heard of it, people who are in the know or have been doing this a long time. Usually we have to kind of begin the process and have a discussion.
Okay, and is there ever a time when you recommend a traditional surgery over the robotic one?
It'd be pretty rare. We're able to move on to robotics now with just about every patient. There would be a couple of small patients that may have a crooked knee that's just too far out of whack, but usually we can get through with the robotic replacement.
Okay, well, it sounds like robotic is the way of the future. Dr. Greiner, thank you for all of your expertise. We really appreciate it. Now, again, St. Mary's Medical Center is offering a free knee pain seminar this evening and again Wednesday, October 23rd. That's from 6 until 7 in the evening at St. Mary's Education Center in Blue Springs. For more information, just call 816-228-5900 or go online to stmaryskc.com. Bill?